Hello, I'm Michael Lombard, and I'm excited to share with you one cool way in which a physician is experimenting with Toyota Kata, specifically to operationalize what I think may be the future of patient-centered care. In patient-centered care, patients and their families are more like partners with their healthcare provider. They experiment together toward the patient's desired health outcomes. Of course, this is easier said than done, but the Toyota Kata approach, which practitioners sometimes refer to as strength training for the brain, provides a way for caregivers to coach their patients, and for the patients to develop the skill set and mental resiliency needed to tackle what can sometimes be daunting health challenges. One example of patient-centered care powered by the Toyota Kata approach comes from the OB/GYN world, where a physician was working with a pregnant patient during a particularly challenging stage of her pregnancy. Basically, the overall challenge, number one, was for the expectant mother and child to have a safe and successful pregnancy. However, in the current condition, number two, the expectant mother was dealing with some serious psychosocial issues, and her health was starting to decompensate due to unhealthy levels of anxiety. The physician, having been exposed to a bit of Toyota Kata training, saw an opportunity in this scenario to step outside the role of physician expert and into the role of patient-centered coach. Through coaching cycles utilizing the structured set of questions, the physician was able to help the patient establish, number three, a target condition, which was to make certain lifestyle changes that would result in her anxiety levels being reduced to safe levels by the time the patient returned for her next follow-up visit. Continuing with the coaching cycles, the patient was able to, number four, conduct experiments, including trying out a meditation app to cope with high-stress moments. As it turns out, the patient was indeed able to achieve her target condition and eventually experienced a safe and successful pregnancy for both mother and child, which was awesome, even though it was just an anecdotal success story. But what truly interested me the most was what it felt like for the physician to step outside of her comfort zone and play the role of coach. So we asked her to reflect upon this experience in the following short video. So I'm sitting here with Dr. Carla Wiggs, and I have a few questions for you, Carla, related to your experiment with trying the coaching kata with one of your patients.
Perfect.
And so, first of all, what inspired you to, after only having a couple of hours of kata training, to start using it with a patient, having not seen that before?
Well, I think that learning this new method really helped me to think about some of the big problems that I tackle with my obstetric and gynecology patients on a daily basis. And sometimes a challenge in working with patients in such a small period of time is that we think about the big problems, but we don't think about how we can break those big problems down into small goals and experiments for these patients to really work on.
So you saw some potential there.
Yeah.
And then I will have shared the example with the audience of how you approached it with your patient. What did it feel like for you as the physician, kind of being in the role of coach, which is not the traditional role that a physician may have been taught to play? How did that feel?
Well, I think that it helped to change the dynamic in the room where I was no longer the expert. I really work on helping my patients to become experts in their own behavior change or their own health needs. And so for me, it was a big shift in how I approach problems and partner with patients.
Now, do you think that that is something that has potential for growth in healthcare, or is it only for rock stars like yourself?
No way. I think, some of the larger challenges in working with patients, there is a slight dynamic where patients feel as though there may be a little power dynamic, and they may not necessarily own their own work and changing their own health outcomes. And what I think this does is that it empowers the patients to engage in the process. And it also simplifies the bigger problems into small, more attainable goals for them to achieve. So I think it's applicable in any situation, not just my own.
That's very encouraging, and thank you so much for your excellent work.
Awesome. Thank you for being the teacher.